Female genital cutting, also known as female circumcision or female genital mutilation, FGM, is quite a controversial topic, but it's something which, especially in the Western world, has received a lot of attention. I want to give some recommended books for people to, especially for sex educators, sex therapists, and sex researchers, or people who are teaching sex, or women who may have undergone different forms of female genital cutting surgeries, who may be struggling to climax or experience pleasure or want to know more about the topic. Here are 10 books to broaden your knowledge and understanding about female genital cutting and the different ways that a woman can experience sexual climax, as well as a number of prominent activists who are campaigning either to end female genital cutting or female genital mutilation, and then those who are arguing that it's a ritual cultural practice or even a religious practice. So that will be the purpose of today's video. I want to give 10 recommendations, 10 book recommendations to understand female genital cutting. So what is FGC or FGM or female circumcision? So female genital cutting refers to any procedure which involves the partial or total removal of the external female genitalia for non-medical reasons. That's the standard definition of female genital cutting. And it's similar to the definition which the World Health Organization uses, as well as UNICEF. Now, what I want to say is that in the Western world, oftentimes um, female genital cutting procedures that are undertaken for non-medical reasons, they're often called or labeled as female genital mutilation by the World Health Organization. And these are generally used to refer to practices, like I mentioned, genital cutting practices, which are undertaken particularly in Africa, the Middle East, and parts of Asia, or in Western societies, but amongst Black and brown people. Whereas when certain genital cutting practices are undertaken in the Western Europe, and in parts of America and Australia, some of these genital practices are known as female genital cosmetic surgery. So things like labiaplasty, clitoridectomy, clitoropexy, clitoral hood reduction, which are all forms of removing parts of the external female genitalia. And these are often done or considered to be done for aesthetic reasons or cosmetic reasons. These aren't considered to be female genital mutilation, according to a number of Western activists and medical doctors. So there is, you could say, somewhat of a double standard. But so I would prefer to use the term female genital cutting because there are a number, and I'll again talk about some of the books that I recommend who talk about, who, especially from Africa, some African women and African activists who argue that there is somewhat of a double standard and an imperialist, racist stance that Western academics and feminists take when they speak about genital cutting practices amongst African and Middle Eastern women. Whereas when genital cutting practices are undertaken in, like I said, in Western Europe or in America or Australia, people have somewhat of a sympathetic or empathetic approach when looking at some of these procedures, even if it's something like labiaplasty, where in parts of the UK it's reported that girls as young as 9 have asked or undergone labiaplasty surgery. So I would use the term for the purpose of this video, female genital cutting, because I think it's more neutral and it encompasses what the West would consider to be FGM in Africa and the Middle East, as well as female genital cosmetic surgeries, FCGS, which are undertaken in the Western world amongst by medical doctors. So these are the 10 books. Book number one, Female Circumcision and Clitoridectomy in the United States, A History of a Medical Treatment. So this is a book that was authored by Sarah R. Rodriguez, who is a lecturer in medical humanities in the United States. This is an excellent book. In the book, she looks at the medical history, the clinical history of two genital procedures, one being female circumcision, which she defines as the removal of the clitoral hood. So the clitoral hood is like the prepuce or like the foreskin, the excess skin which covers the clitoris. And the second procedure, which is known as clitoridectomy, which is the removal of the clitoral glands or like the clitoris. So what she explains is that both these procedures, both female circumcision and clitoridectomy, was practiced in the US as far back as the 19th century. Some of them were undertaken by under the advice of medical doctors and physicians, American physicians, white medical physicians, who said that these some of these treatments can help women who are either having issues with masturbation or women who maybe have are finding it difficult to orgasm during intercourse. So they looked at some of these procedures to kind of help women. They looked at as a cosmetic surgery to help women experience climax during penetrative intercourse with their husband. So it's a really fascinating book because many people are not aware of how female genital cosmetic surgery or female circumcision was practiced in the United States. And she argues that it's still even practiced today, but it's practiced under female genital cosmetic surgery as opposed to it being labeled female circumcision or female genital mutilation. So this is a really good book, excellent book, well researched. Female circumcision and clitoridectomy in the United States, history of a medical treatment. So this is again an excellent book. That's book number one. Book number two, Female Circumcision. So this book is a it was edited by Moria Mustafa Abu Sharaf, who is a senior research associate at Brown University. So this book is a collection of it's a volume of a number of essays by from a multicultural perspective, looking at the topic of female circumcision, and it highlights a number of African activists, African women in particular, who are trying to eliminate and eradicate female genital cutting or female circumcision. But it talks about again how they're looking at the different cultural practices. So it looks at different cultural practices of female circumcision in Sudan, in Kenya, in Somalia, and different parts of the African continent, and how many activists, like I said, are trying to eradicate the practice in accordance to their local custom, local norms. And again, it's a really excellent book because it's one which amplifies and looks and amplifies the voices of Africans and African women in particular. And rather than having like the West to kind of who spearhead the project. You have African activists, like I said, underground, who understand the culture, and also explaining that some cases, like with some female genital cutting practices, they're not always undertaken for to reduce or curb a woman's desire. Some of them believe that it is a form of beautification. Like there was one woman from I think it was from Nubia, I believe, who she mentioned in one of the I think it was the second chapter. Yeah, the second chapter. Had this been your face, would you leave it as it is? So it's a really interesting exchange with the researcher Fadwa Al Gundi, and she spoke to a woman, an Egyptian woman, who was a circumciser, and she mentioned that the way they view female circumcision is similar to how people maybe do surgeries on their face in the Western world. And she argued that by them cutting parts of the external genitalia, whether it's the labia minora or part of the clitoris, for them they saw it as a form of beautification or to enhance sexual pleasure. So it's very interesting. Again, like this is something that the book excellently demonstrates is that different cultures they view these different ritual practices differently. It's not always to curb female desire. Some of them they believe is in a form of enhancement for sexual pleasure. Some of them they see it as a form of beautification. And what she also the book does highlight is that oftentimes it is women that are endorsing these practices and want the practice to perpetuate. It's not necessarily because of patriarchy, which a number of feminists from the West will kind of argue. So again, this is a really excellent book, especially for anyone who wants to hear the perspective of African activists from a different perspective, because Africa we know is not a monolith. There are many countries in Africa, hundreds of cultures. So again, if you want to really read a book about female genital cutting from an African perspective, and those Africans who are trying to eradicate female genital cutting or female circumcision, this is an excellent book that I definitely would recommend. So that's number two. The third book I would recommend is Transcultural Bodies, Female Genital Cutting, a Global Context. So again, this is a compilation of 13 essays where different activist experts, primarily from Africa, but those also who are living in African diaspora in the United Kingdom, Europe, Australia, and the US, they all speak about their different approaches towards female genital cutting and how it's viewed in the African continent and how similar to again to the previous book, it's not always looking at it from the perspective of a Westerner or white European. You have some activists who are speaking about who actually campaign for female genital cutting, and they don't consider it to be a form of mutilation. So that's another reason why I try and not use the word FGM anymore, because I think it can be culturally insensitive because there are a number of women who have undergone different genital cutting procedures, but they don't consider it to be a form of mutilation. So they present the different arguments. There is one prominent activist who talks about female genital circumcision as a form of an empowerment. She wrote a really interesting article. Let me see if I can find it. Yes, so it's actually the 12th article. Ain't I a woman too? Challenging myths of sexual dysfunction in circumcised women. And that is an article by Fuambi Ahmad, who is a US Sierra Leonean anthropologist who she speaks about her own experiences of going back to Sierra Leone to experience female circumcision as part of a initiation practice called Bundo. And she went there as an adult, and she spoke about that she was still able to have a fully active and enjoyable sex life prior to circumcision and after. So it's very interesting because she debunks a number of the some of the myths that are perpetuated in the West that women who have been circumcised aren't able to climax or orgasm. So again, it's just a really interesting account. There's other activists, like I said, female voices. So if you want to kind of learn more about the different perspectives of how Africans view female genital cutting, especially African women, trans cultural bodies, female genital cutting in the global context is a really excellent read. Book number four, Cut. So book number four is Cut. One Woman's Fight Against FGM in Britain Today. And this is written by a Somali woman who's based in the UK now, an FGM activist, anti-FGM activist, Hibo Wadaderi. Really, I mean, it's a very tough read because she talks about her experiences, her traumatic experiences undergoing female genital, what she labels as female genital mutilation, which I think was the third type, which is infibulation. And this is where both the clitoris and the labia minora, so the clitoral nub and the excess skin of the excess skin that covers the clitoral hood is removed, as well as as well as the vulvar lips are removed, and then there's a surgical procedure done where the vaginal opening is surgically kind of cut, so there's only like a small hole left for urination and menstruation. Um, and again, it's one of the most severe types of female genital mutilation, if you want to call it, according to the World Health Organization, type 3. She speaks about her traumatic experiences going through that in Somalia, and now the great work she's doing to educate and campaign to end this practice, particularly amongst Somali people in both in Somalia as well as in the UK. This is a really excellent book. First person account of the horrors of, in this case, female genital mutilation, and an African activist, a black woman who's campaigning to end it. So again, this is a really, again, to understand not only the practice but also some of the difficulties that an activist may face. Speaking from my own personal experience, like I said, when she went through female genital mutilation at 6 years of age. So again, this is a really powerful book. The next book, Female Genital Cutting and Sexual Response. So Female Genital Cutting and Sexual Response. And this book was authored by Mansoura Bobiko, which is this book is it looks at the cultural practice of what she calls female genital cutting, or female circumcision. She doesn't label the practices as female genital mutilation. But with her book, it's again it's quite an academic, well-researched book. It looks at how different types of how female genital cutting is perceived in Eritrea, as well as Eritrean communities in Australia, where there's different forms of female circumcision, particularly the type 3 infibulation. But she interviews a number of, like I said, Eritrean women and men and how their views about the cutting practices and how a number of them don't consider it to be a form of mutilation and how a number of women are still able to experience sexual pleasure, sexual climax. So she's mainly looking at the approach, not really from an activist, but more a case of helping people, especially non-Westerners or people outside of the culture, understand how people from that culture themselves view female genital cutting. And she argues again that the global discourse on female genital cutting and sexual response is somewhat false, and the idea that if a woman has been circumcised or experienced FGM, that she wouldn't be able to experience an orgasm or enjoy sex. Whilst that is the case for many women, she puts forth like that an evidence-based research that there are many women who have undergone female genital cutting but are still able to experience sexual climax and pleasure. And then she talks about some of the challenges and uncritical assertions of the negative effects on FGC, on sexuality, and interrogates the sensuality of the clitoris in female orgasm. So, whilst, especially in the West, there is a lot of onus spoken about the clitoris and the importance of the clitoris for women to experience an orgasm. And, we often hear, like there's 8,000 or 10,000 nerve endings in the clitoris, and the clitoris being the key to female orgasm and this, that, and the other. She argues that in other parts of the world, like in Eritrea, where the clitoris is not seen as the be all and end all because there's still ways for a woman to experience an orgasm without external clitoris stimulation because a number of those women, their clitoris have been um, exercise has been removed, but they're still able to experience an orgasm just as much as a woman who hasn't been circumcised. So again, really, really good books. It's an essential read for educators, healthcare workers, doctors, nurses, counselors, sex therapists, policymakers, indigenous individuals and groups, feminist activists and advocacy groups, anyone who's interested in female sexuality, especially within an African perspective. So again, very good read, excellent book. Highly recommended. Females Genital Cutting and Sexual Response by Mansoura Gobiko. So again, excellent book, highly recommended as well. The next book I'll recommend is Female Genital Cosmetic Surgery. Female Genital Cosmetic Surgery, Deviance, Desire, and the Pursuit of Perfection. So Female Genital Cosmetic Surgery, written by Camila Norca, who has a PhD, is a gender studies scholar living and working in Australia. She has also taught as a lecturer and tutor in a number of Australian universities. Now, this book is a really fascinating book. It examines the history of female genital cosmetic surgery, as she labels it, particularly looking at the procedure known as labiaplasty. So labiaplasty is a procedure where a woman's external genitalia, especially obviously the lips, they are trimmed partially or totally removed in order to attain this what is considered to be a desirable look or like a quote unquote normal look or normal vulva or normal vagina. It has some links to like what is commonly referred to as like the designer vagina or the Barbie vagina, where you have a woman whose lips are symmetrical, are tucked in, and it kind of looks like what is commonly shown in porn and things like that. So she looks at the history of female genital cosmetic surgery, similar to the book I mentioned, the first book in the US perspective. She's looking at it not only in Australia but in Western Europe. So she looks at the history of it dating back to like ancient Greeks and what they considered to be a so-called normal genitalia. And also what she does argue brilliantly is how the difference of how, especially a number of Europeans or white people or Westerners, how they what they consider to be a normal genitalia, and how that differs from when they came across Southern Africans, and when they saw a number of Southern African women who had elongated labia, they labeled that as labial hypertrophy. So they consider if a woman has extended or long or protruding labia, they consider that to be abnormal and deform and a form of deformity. Whereas if a woman has a very tucked in and more or less invisible labia that you can't see, they consider that to be perfect and ideal. And she was arguing that this demonization of a protruding labia, it's racist because there was some gynecologists, like one particular gynecologist, he escapes my name from France, who said that an external or protruding labia is commonly found in African women, whereas the either the tucked in or the butterfly look labia, which is commonly found in like European women, and they consider that to be more desirable. So what this book brilliantly does, it looks at, like I said, the history, the medical history of female genital cosmetic surgery, and she traces the origins of contemporary ideals of genital normality. So this idea of what is a normal vagina, and I'm using the vagina here referring to external female genitalia. I know, like technically, the vagina refers to the inside, the vaginal canal, whereas generally when people say vagina, they refer to the whole female anatomy. But she talks about how what people kind of consider to be a normal or desirable vulva or the appearance is one which is shaped by like a racist kind of history. And then she investigates how Western women have become increasingly worried about the aesthetic appearance of their labia minora, now turning to cosmetic surgery to achieve the ideal vulva, which is a clean slit with no visible protrusion of the inner lips. Then she goes on to say long labia minora, which is the the inner lips. Long labia minora are described by medical experts as hypertrophied, a term that implies deformity and atypical. But how far back does the diagnosis of labia hypertrophy go, and where did it originate? And what she does, she brilliantly does in this book, she tells the story of the female genitalia from the alien world of ancient Greek gynecology to the colonial period of exploration and exploitation up to the present day, bringing together historical, medical, and theoretical documentation and commentary. The author uncovers a long tradition of pathologizing female anatomy, a history sure to be of interest to any reader who wishes to know about how medicine shapes our commonly held ideals. Really good book. And she makes a fascinating argument that so like some women when they go to like a gynecologist and they may have protruding completely normal and healthy looking, but the gynecologist may say, you know, your labia, the woman's your lips looks fine from a gynecological perspective, is healthy, but cosmetically it's not that attractive to kind of encourage women to undergo some form of labia plasty. So she kind of challenges these ideals, these genital, like I said, genital ideals of what is considered to be normal and desirable, and how a number of women, like I said, they are being sold this idea that their genitalia is not attractive or it's not desirable, and that's why a number of women undergo labiaplastic cosmetic surgery. So and what she does again, she looks at the history and she said it's not just about porn because a number of these ideas about what is ideal genitalia, it came from before porn was like prominent in the Western world. So she a lot of times it's blamed on porn, but she argues that the medical community or medical doctors like physicians and some cosmetic surgeons, they also are to take have to take some responsibility in kind of creating a lot of anxiety and issues that a number of women are facing in relation to the way their body looks. Because what she's trying to explain is that the genitalia comes in different shapes and sizes, and there isn't just like one, or there shouldn't be just one form of what's considered to be ideal or normal. So that's a really excellent book. I would recommend. The next book, Circumcision. The next book is Circumcision, A History of the World's Most Controversial Surgery. So, Circumcision, A History of the World's Most Controversial Surgery. Hopefully, you can see that. And that is a book that was written by David Golaher, who is the president and CEO of the California Healthcare Institute. So this book really it explores the history both of male circumcision and female circumcision of this medical practice and a substantial risk to the patient and offers very little benefit. So he's arguing against female against circumcision, both for men and women alike. And he's a historian of medicine. And he looks at the history of what he considers to be medicine's oldest enigma and most persistent ritual, which is circumcision. So he looks at it from being a ritual practice from ancient Egypt through the Hebrew ritual purification acts through to in the Islamic world, in Islamic texts and the Muslim world and amongst Arabs, how female circumcision was practiced amongst towards for men and for women. and then he looks at it up until like the 19th century. So again, a really interesting book on the history of circumcision across different cultures around the world. Yeah, I found this book quite easy to read. Again, looks at circumcision in the Jewish tradition, the Christian tradition, the Muslim tradition, um, how circumcision is viewed in science, and the backlash towards female circumcision, and why now in contemporary times female circumcision has been like now considered to be form of female a form of child abuse, and with the whole FGM activists and those who are campaigning against it. So this is a really fascinating and comprehensive read. Really thought provoking. Again, really interesting read, especially for those who are historians or interested in the history of female sexuality and circumcision in particular from a cross-cultural perspective. The next book, the eighth book, is called Circumcision in Islam. Circumcision in Islam, and this was authored by Abu Bakr Abdul Razak. So Circumcision in Islam, really good book, very easy to read. It kind of gives a summary. Originally, it's written in Arabic, I believe, but it gives a summary of what different Muslim scholars, gynecologists, medical doctors have to say about circumcision, particularly female circumcision. Some who are pro-circumcision, some who are anti-circumcision. And it mainly cites scholars and medical experts from Egypt, where it talks about the history of circumcision from an Islamic or Muslim framework, the origins of it from Muslim texts. And again, like I said, it talks about how circumcision was a practice that predated Islam. It was practiced, and some say it originated in ancient Egypt, some say it originated in the story between Prophet Abraham, and and his wife Sarah and his other wife Hajar, where there was an incident between the three of them, where Sarah, basically, I mean, the story is disputed, but it's a really interesting history looking at the history of circumcision within Islamic tradition. And then different Muslim scholars, he does quote Ibn Qayyim al-Jawziyah, who is a scholar, famous Muslim scholar, who spoke about circumcision being an Islamic practice and how one should, and the legal rulings in regards to circumcision for boys and girls. And he quotes a section on circumcision for children. So again, he presents both sides on those who again are pro circumcision and those who want to eradicate and eliminate circumcision and argue that it's not an Islamic practice. So it's again very easy book, really easy book to read. Circumcision in Islam by Abu Bakr Abdul Razak. You can pick that up. The ninth book is my book, A Taste of Honey, Sexuality and Erythology in Islam. So I've got a section on female circumcision, which is in chapter 2. So I present how Muslim jurists or number of Muslim scholars in the past, how they viewed female circumcision to either be a permissible act, or some scholars even considered it to be obligatory. And then how a number of Muslim scholars argue that female circumcision in Islam is a different practice to female genital mutilation. They argue that whilst Islam recognizes female circumcision, they argue that it doesn't recognize or it totally prohibits female genital mutilation. Now, for the Muslim scholars who consider female circumcision to be an acceptable practice, and some would consider it to be a Islamic practice, they argue that the clitoral, like if anything, only the skin should be cut. So that's the clitoral hood, not the clitoris itself, not the clitoral gland, and not the labia minora. So I talk a little bit about the difference of opinion among scholars. There are a number of contemporary scholars who now argue that the prophetic traditions, the hadith which speak about female circumcision, are weak and unreliable. Therefore, we can't rely on it to give legal rulings. But there is definitely examples within Arabic literature and historical texts that female circumcision was well known amongst the Muslims, amongst the Arabs, even prior to Islam. That the Arabs, even before Islam, will refer to a woman who was a female circumcised that's called Muqatta'at al-Budur, meaning the one who cuts clitoris. And they would also insult someone by using the term saying Ibn Badra, meaning the son of a woman with a large clitoris. So a woman with a large clitoris was called Badra, because al-Badr was known as a clitoris, and Budur is a plural of clitoris. So um, the Arabs knew of female circumcision. It was known in their society, and they used to, like I said, prior to Islam, practice clitoridectomy, which is the cutting of the clitoris. But according to Muslim scholars who say that female circumcision is an acceptable practice, they argue that the hadiths which the Prophet peace upon him is was reported to have spoken to a female circumciser. He told the woman not to excessively cut, meaning just cut lightly, referring to the excess skin, meaning the excess skin that covers the clitoris, not to know not the clitoris itself. And this is what some Western procedures will refer to as either female circumcision or what is known as the dorsal cut, which is like a slight incision on the clitoral hood, not the clitoris again itself. And that's supposed to help a woman who maybe experience difficulty orgasming if the clitoral hood is exposed, or there's a slight slit. It might help the clitoris become more exposed and help a woman experience an orgasm. But I'll talk a little bit about that later. But I want to talk about the 10th book. Again, another one of my books, Women of Desire, A Guide to Passionate Love and Sexual Compatibility. So similar to Ateza Planning, I bring in what some other Muslims and Africans from a cultural perspective have said about female circumcision, some who consider it to be, like I said, an acceptable cultural practice. So I talk about a West African activists, a couple of West African activists who speak against the African activists who speak against the Western approach towards female circumcision, and they don't like the way Africans are being demonized for undergoing genital cosmetic practices, whereas when it's the West, it's considered to be acceptable. So, um, yeah, I'll talk a little bit about that in this book and the different cultural perspectives in viewing female genital cutting. So they're the 10 books. Hope you find it somewhat interesting again for those who are interested in learning more about female genital cutting, or whether you want to call it female circumcision or female genital mutilation. They're really good books from different perspectives. Some who are pro female genital cutting, some who are totally against it, some who are just academics and historians and presenting the history and the different views and how it's viewed in different parts of the world. They're 10 books that I definitely would recommend to learn more about female genital cutting. I personally am not an advocate or support it, but I think it's important that as sex educators or counselors, one does develop cultural competencies and is able to empathize and understand the different viewpoints that people have towards certain practices. And also from an Islamic perspective as well, there is clear evidence that female genital cutting was practiced in parts of the Muslim world. So I don't think one can deny that. And there are many reputable scholars who do believe that it is a Islamic practice, but there are a number of contemporary scholars who are now arguing that because of the harms, perceived harms that it causes, we can eradicate and eliminate the practice. But yeah, they're books if anyone wants to learn a bit more about those practices.